Hello, so we're back. Now let's talk about one fungal disease of the central nervous system, which is cryptococcosis, caused by Cryptococcus neoformans, and that is a meningitis. So you breathe an air that is carrying spores from Cryptococcus neoformans, and usually dust can bring through the wind these spores. And these spores come from pigeon and chicken droppings, okay? That's where they're found. The capsule of this fungus is really thick. That's what gives the big resistance to the environment and ability to get to your nose. So it's transmitted by the respiratory route through these dried contaminated droppings. Usually happens in immunocompromised individuals, and mortality is up to 30%. Needs to be treated with antifungal drugs. One protozoan disease that is super important in the nervous system is the African trypanosomiasis. It's caused by Trypanosoma brucei. There are two different types, the gambiense and the rhodesiense. They have their reservoirs is different. One is only human and the other you can get from livestock and wild animals. As the name says, this disease is common in Africa and it's transmitted from animals to humans through a fly that is called tsetse fly. The distribution is common in Western Central Africa. The symptoms in the beginning are mild, but then they start to get worse, and then you have fever, headache, and deterioration of the central nervous system. Interestingly, the proportion of flies that are infected with this parasite is really low. Pregnant women can pass T. brucei gambiense to the baby, and other routes of transmission are also possible and include sexual, blood transfusion, and organ transplantation. So the problem with this parasite is that it has a very high tendency to antigenic variation. Remember when we talk about this? They change the surface antigens weekly, and it's so difficult to keep track of the microbe and even to develop a vaccine. So if you look, in the first week after the infection, person had the clone A. In the second week is a different clone. Third week is a different clone, and it keeps changing. So it's really hard for the immune system to keep up with all these changes and attack it. Okay, so that's how they evade the immune system. What else I wanted to tell you here? So it's fatal if it's not treated. It's common to have fever, headaches, very severe headaches, irritability, fatigue, swollen lymph nodes, aching muscles and joints, and sleeping. The person feels sleepy often, doesn't sleep well at night, but feels sleepy during the day. Some people develop a skin rash, and the progression of disease is related to confusion, alteration in behavior, personality changes, other neurological problems that can happen also that are related to central nervous system disease. Death can occur within months if it's not treated. Since 2015, fewer than 100 cases have been reported annually through the World Health Organization. Hospitalization is usually necessary, and they require a lumbar puncture every 6 months for the next 2 years to follow up if the infection was really gone. How to prevent? Eliminate the tsetse fly. That's the best way to prevent a vector caused disease, is by eliminate the vector, right? And there are different ways that they can use for that. Other protozoan diseases, in this case caused by amoeba. There are two different amoebas that can cause meningoencephalitis, which are the Naegleria fowleri. It's super uncommon and rare. But when it happens, there's no treatment, and 100% of the cases is fatal. So this amoeba goes when you're swimming in waters contaminated. They go through your nose and get to the brain through the nose. And they feed on brain tissue. So they eat tissue. So this is an amoeba eating another dead amoeba, but they also eat the brain tissue. That's how they cause disease, and it happens really quick. Another one, the acanthamoeba, causes granulomatous amoebic encephalitis, or GAE. These granulomas form around the site of infection and also cause some type of brain lesion. And then prions, that's the last one. And we're done with this chapter. So prions are abnormally folded proteins. Prions are not viruses, are not bacteria. They are a totally different type of agent that is not even alive that can cause these diseases. So diseases that are commonly caused by prion are transmissible spongiform encephalopathies. That's the name, because they cause some type of lesion in the brain that makes the brain look like a sponge, because it makes holes. The cells in the brain tissue die, and I'm going to explain to you how. Name of some diseases that we don't need to get into a lot of details here, but you have the Creutzfeldt-Jakob disease, common in humans, Kuru, bovine spongiform encephalitis, which is the bone mad cow disease, and it's because cattle eat contaminated bone meal from sheep, and that's how they get it. And then if we eat the meat contaminated from the cow, that's how we get it. That's one way to get it, right? There are other ways. So if you get by injection, you may think, well, but if I really fry and cook well my meat, then I'm not going to get, even if the meat is contaminated. So this is the thing. These prions, they do not get neutralized by heat. You need to add sodium hydroxide or sodium hypochlorite and then autoclave. Just autoclaving doesn't inactivate these proteins, okay? Other ways to get it other than eating this meat is by contaminated human growth hormones that you can use, dura matter, corneal graft and corneal grafts, neurosurgical equipment. These are other ways to get prion disease. Okay, so that's why sterilization of materials prior to surgery with prior treatment by chemicals is essential. So I want to tell you how this disease works. One case per million in the United States, so it's very rare here. These are the holes that you can see in the brain tissue, okay? So this is how this happens. You have a protein called PRPC, which is our endogenous protein, right? These proteins are related to mechanisms that control and regulate cell death in neurons. If this protein is inactive, your cells, your neurons, are going to start to die. So these proteins are exposed in the surface of neurons, and then they connect to the PRPSC, which is the one that comes from the cow or from the infected fomite or whatever way they got into your brain. That protein binds to our normal PRPC protein and transforms it into an abnormal protein. So you see, this one touched this one and transform it into this one. And then the abnormal ones, which are the orange ones here, keep touching, kind of like hybridizing with other normal PRPC proteins in our body and transforming it. They transform by contact. And these transformed proteins go inside an endosome, and they keep transforming the good ones. And without the good PRPC protein, these cells start to die. And that's why you have that spongiform appearance in the brain. All right, we're done with chapter 22. I hope you enjoyed it, and I will see you again for chapter 23. Bye-bye. Have fun studying.